My name is Leanne Jalon. I'm the Director of San Juan Basin Public Health here in the southwest corner of Colorado, serving Archuleta and La Plata counties with this week's COVID-19 update. The question we've gotten a lot this week is, when is Southwest Colorado, or when is the state of Colorado moving into higher levels of restrictions? In Colorado, these higher level of restrictions are called purple on the mitigation dial. In other communities and other states and other cities, these are often called stay-at-home orders. So just to remind everybody, when a community or a city, a county, a state is experiencing a surge in cases, oftentimes there are increased restrictions that are ordered by public health orders in that state to limit spread of infection. There were additional restrictions through the month of November for both counties served by San Juan Basin Public Health. They were ordered by the state of Colorado to move into level red. We have seen that this move into level red really does have an effect on cases and slows down transmission. If we keep to our own household, if we continue to wear our face coverings, if we maintain that 6-foot distance, and we do anything we can outside where we're less likely to spread disease, we have the opportunity to not move into purple unless the whole state has a overrun of healthcare and it's a statewide decision. So just to clarify, there is not a metric that we hit that makes our community move to purple. Those, yellow, orange, red were ordered by the state of Colorado when we hit certain metrics. Purple is a much different look of what the healthcare availability across the state is. We all can do our part to not get there. The way that we do this is we did it over Thanksgiving. We saw a 30% reduction in travel and a 30% reduction in household mixing for the Thanksgiving holiday. We're going to have these conversations in the next 2 weeks about why it's so important to just have one last set of holidays. Different, creative, let's figure out ways we can celebrate together and start looking to a future in the next couple of months where vaccine is available and we can get back to normal lives. We've all been tracking the national news and know that vaccines are coming. So here's what it looks like in Colorado. We have about 5.7 million people living in Colorado. We expect that today Pfizer will get the emergency use authorization to start distributing its first shipment of vaccine across the country. When that happens, Colorado will have access to 47,000 doses. So just to be clear, there's 5.7 million of us living in the state, and our first shipment's going to be 47,000. These 47,000 doses will go to high priority healthcare workers. And this is, part of the question you just asked, how do we get to purple? The reason we have to protect our highest priority healthcare workers is because they are exposed to COVID and we need them healthy to continue to treat people. So the first 47,000 doses will go to this very top priority of healthcare workers. We expect over the next month or so to get the full suite of that top priority of healthcare workers. And then Colorado will start working its way down through the priorities. So February will move to the next phase, which includes first responders, other critical service workers, other types of healthcare workers. By springtime, we'll hit other priority populations, including people over 65, people with chronic conditions. And by summertime, this will be available for the general public. So this is an amazing story that vaccine is available, it's effective, and it is safe, and it is available at this timeline. The hard part is that we can't let our guard down now because we think we're getting to the end of this. The way we've been describing it to people in the last week is this is like you've gone on that cross-country road trip and you're the last mile to your house, and this is not the time to get into the car wreck, right? So we have been on this journey together. We are getting to the end of the journey. We still have to practice our precautions, and we will have to practice them for many months to come, but we know that this is headed in the right direction. And just remember, it can't come fast enough for people that are in really, really difficult circumstances. We're seeing that right now in one of our long-term care facilities, and our heart goes out to individuals that have been waiting for so long to get to the end of this pandemic and are still experiencing tragedies. So remember, we're still in this together. Vaccine is coming, but what each and every one of us does as individuals for the next couple of months continues to be an important part of keeping each other safe. And we look forward to continuing this conversation as a community.